Minute brought to you by St. Francis Health, serving our community for 111 years.
And welcome back. Well, today is Maternal Health Awareness Day, and experts say the maternal death rate in the U.S. is way too high. Mandy Gaither has details.
It's considered one of the world's most powerful countries, but when it comes to maternal health, the U.S. remains weak. For every 100,000 live births in 2022, there were about 22 maternal deaths, with Black women being the most affected. That death rate is more than double, sometimes triple those seen in most other high-income countries that year.
It's an ongoing concern, and we're doing lots of things to try to bring those numbers down and get us into a better space.
Dr. Sarah Sams with the American Academy of Family Physicians says many of the maternal deaths are preventable, some linked to chronic diseases like obesity, hypertension, and diabetes. She says establishing care early on in a pregnancy is critical, but not everyone has easy access to that care.
Family physicians still provide maternity care in many areas, and especially in rural and underserved areas, kind of trying to alleviate some of those maternity deserts.
Sam says having a healthy diet, exercising, avoiding smoking, alcohol, and drugs play a big role in a healthy pregnancy. And since many maternal deaths happen up to a year after birth, she says postpartum care is also critical, especially if gestational diabetes or hypertension were present in pregnancy.
Many of these conditions are signs that you may be developing those as a long-term chronic problem.
For Health Minute, I'm Mandy Gaither.